Friends, and welcome back to the program. Well, it seems like more today than ever we are becoming very aware of what we are putting into our bodies, and especially where it regards imports from other countries. Well, that has affected I guess the dental industry, you could say, or the dental profession. Yeah. And that's why we welcome in Dr. Todd Shatkin this morning to tell us what to watch out for, and also to assure us that Aesthetic Associates doesn't outsource anything that could possibly result in harmful imports getting into the material. That's good to know.
That's right, John.
That's very good to know.
Yeah, well, I'm glad to be here, and of course, as usual. And there was some recent news in the I believe on your network. About a week ago, they did a program on I believe it was on the Today Show, and it talked about dental work being done in other countries, especially China.
Yeah.
And you know, there's been recalls of toys for children because there's been lead in the toys, and they've had to take millions of toys off the shelves. Yeah. There's been recalls of a lot of things, but yes, nobody really expected it to hit the dental profession. And it's very unfortunate because some dentists, in an effort to try to save some money and have you know, better profit, I guess,
yeah,
have sent their work over to China and other Asian countries. And the biggest concern in my mind for the past couple of years, when I started hearing about work going over to China, yeah, especially in the last 12 to 18 months, it's become very popular, is I was worried about the metals, because there's always the concern about lead being in the metals.
Yeah, yeah, for
now
sure.
We're finding out that that lead is also in the ceramics, in the porcelains that they're baking on top of the metals. So I've been fortunate. Ever since I've been in practice, we've had an in-house laboratory at our office, and we keep all of that, the majority of that work, right in-house, and everything we've ever done has been done in Western New York. And one of the things in the past couple years, we've really developed our own full-service in-house laboratory. Now we do lab work for dentists all over the country.
Yeah.
We have about 1,200 dentists that send their work actually to Buffalo, to our lab in our building, and we do the work in the building for them.
Good to know.
But the concern is not just the dentist sending the work to China, but there's been stories recently that local laboratories are sending work to China.
So a dentist could be sending his work to a local lab, not knowing that they're outsourcing it.
Right.
Yeah,
and
wow,
that's a real concern, because
yeah,
the dentist may not be aware, you know, and the lab may be saving $20 or $30 on a crown and sending it over to China to be made. And who knows what's in that material? You know, they said they're melting down electronics, old electronic keyboard, you know, electronic circuitry and circuit boards to make metals that are being made in children's costume jewelry and in dental materials and things like that. It's just terrible.
You know, the funny thing, Doctor, I think up to a certain point, when we found out something we'd been using prevalently had lead in it, we've always kind of thought it must have gotten in there by accident.
Right.
It almost sounds like they're purposely constructing things with lead.
It's so inexpensive that they just put it in there and they melt it down and they use it. And the important thing to know, if you're coming to my office or anybody's dental office, you need to have some reassurances from your dentist.
Right.
I had 4 or 5 patients last week come in and ask me, where are my materials made? Are they being outsourced? Because this is becoming a very big.
I think people were paying attention to that report.
They were.
Yeah.
And so what I want them to understand is a couple things. Number one, we're very fortunate in Western New York to have a company called Ivoclar Vivadent.
Yeah.
Right in our back door, right in Amherst. And they also have Williams Gold, who's been around in Buffalo for decades, and that's owned by Ivoclar. So all of those metals are made here in Buffalo.
Ivoclar has had a mobile display at the Erie County Fair for a few years. I remember going in there. Oh, by the way, Doctor, we have a call. You want to take your call?
No problem. Yeah.
Let's take our call. Good morning. Hello, caller.
Good morning.
Oh, okay. Well, they're not there. They chickened out.
What I want to let the consumers know is, when you go to your dentist, ask them for some kind of assurance. And the easiest way is, when you have any metal done in your mouth,
okay,
the dentists are provided with this sticker.
Okay.
And basically it tells the content of the metal. Okay,
There you go.
it shows the percentages of the different metals, and this is a requirement by the FDA.
Now, is that sticker uniform like that? That's the same sticker that
Well,
would be
it's
on...
different from different types of metals that we use, and I
Right.
brought 3 different samples of metals here,
Okay.
but you can inspect it, and you can see, you know, there's gold, there's palladium, there's silver, there's a little bit of titanium, but there's no lead.
No lead.
And this is required, and it's required to be given to the dentist. Now, what comes from China, who knows what if they give these stickers or not? I've never seen them. I don't know.
Now, are we too early with this, or is this something else you want people
talk
to
about
look
that.
for?
I'm going to show
All right.
that. But here's 3 different types of metals. I'll just hold these up.
Okay.
These are a bright gold metal,
Yeah.
and you see this is from Williams, Ivoclar Williams Viva.
Yeah.
There's a Harmony metal,
Okay.
and then there's a Lodestar, which is a semi-precious metal. But all of these metals are FDA regulated and approved.
All right.
Okay.
Now, those are just different...
And these are the actual ingots of the metal. You can see the gold right through the packaging. So, but
Okay. Those are varying grades of gold,
yes,
right? You're right. Okay.
yeah. And dental materials don't have to be gold, but they need to not contain materials that are harmful. So you can use nickel, chrome, and cobalt. Those are all safe metals for the mouth as long as it's you know, proper grade.
Okay.
So,
All right.
so that's important. And then,
Now, does this bring us back to these stickers here?
yeah,
All
and
right.
then you look at the porcelains that go on top of the metal.
Yeah.
And that's a ceramic material. Here's an example of a product called Emax.
Okay.
Emax Ceram, and maybe they can join it. And that again is an Ivoclar product. And you can rest assured that any Ivoclar products are FDA registered and regulated.
Is that sealed, or is it something
this
else?
could be open. This
you
is
can
a
open that?
This is a bottle. This one actually is sealed.
That, I saw that it looked like there's a bottle
yeah,
in there.
it will come sealed. But this is a powder.
Okay.
And it gets painted onto the metal substructure. So what you end up having is a bridge made out of porcelain.
Okay.
And here's an example of that, if I can show a ceramic porcelain bridge.
Yeah. Actually, doctor, can you put it on that blue field and then turn it up like this? It might show
try.
better.
We can
There
try.
you go. I'll be darned. That's great. Now, what does the powder do? The powder.
Well, the powder turns into porcelain when they bake it in the oven.
Oh, that's a powdered porcelain.
Right.
Oh, I understand. I see.
And so that's baked on. And then, of course, here's another bridge.
Yeah, keep that on there.
And this particular one is porcelain fused to a white gold metal.
Okay.
And you see the gold underneath.
Yeah.
But the important thing is, on the top of these, we put a certificate, and it says Emax certified. And if you zoom real close in, I don't know if you can do that, but it'll say made in North America.
Yeah.
And that's just the type of things that the patients need to know, and the dentist needs to know where their cases are coming from.
We have another call.
Yeah.
Good morning.
Morning.
Hello?
Hello?
Yeah.
I would like to know the difference between the crown and the bridge, and I'd also like to know if the porcelain is better than the solid gold for these types of cosmetics.
Okay, well, the question, first part I think I heard was the difference between a crown and a bridge. A crown is a single tooth cover for a single tooth,
Right.
and a bridge would be to replace multiple missing teeth.
Okay.
And would be usually connecting 2 or 3 crowns with a portion in between, and that would be
Okay.
a bridge.
All right.
Now, the other part of the question is which is better, gold or porcelain? It's not necessarily one is better than the other. It depends on the area of the mouth for aesthetics. Obviously,
Rappers like gold.
yeah, some people might like to have a nice grill in the front of their mouth, where others would prefer to have porcelain. But we typically put the gold crowns in the back of the mouth, the yellow gold, if somebody wants gold, where we put the porcelain in the front. But both are fine and safe and effective as long as you're using the right materials, as long as we're using regulated, registered FDA materials.
Tell me about the gold that is used in the mouth. What's the percentage of gold?
There's varying percentages. This particular one that we have here, it's 51% gold, 38% palladium, and a little bit of silver. So, but
I was reasonably sure it wasn't 24 karat, because you can actually mold 24 karat.
Right. They typically use 18 karat gold. That's usually what's normal, sometimes 14, but usually 18 karat is the golds that are used for all gold crowns.
Okay.
But like I said, it doesn't have to be all gold. You don't have to spend the money for the all gold crown, as long as you know that whatever materials your dentist is using are approved and regulated.